Okay, hello. My name is Guillermo Gonzalez. I represent Arroyo Insurance Services, and we are your employee benefits coordinators, okay? So this is your 2016 open enrollment meeting, and I'm going to go ahead and get through the information we have to present today. We do have a lot to cover, so sit tight. All right. Arroyo team is here to review the employer-sponsored medical insurance. We're going to present any changes every year. And then we also assist HR in managing your benefit. August is the open enrollment period, so right now would be the only time to make any changes on your plans other than if you're a new hire. If you're a new hire, you'll have first of the month following 60 days of hire to make your plan selections. So in this meeting, you're going to have the opportunity to ask questions and discuss your specific needs. Okay, so what's staying the same? We're able to continue very high level of benefits. So all full-time eligible employees are going to be able to select medical and dental plans, sharing the premium cost with your employer. So $25 per payroll deduction gets you into the base HMO plan, the base plan for your employer. And because you're out of state, that is going to be the PPO plans, okay? So all insurance carriers are remaining the same, and the plans we offered last year will continue. So CalChoice remains the same private exchange provider. You will have PPO options from Anthem Blue Cross. VSP will remain your carrier, your vision carrier. Okay, so what's changing? Effective September 1st, 2016, Unum is now your new group life, accidental death and dismemberment, long-term disability, and voluntary life provider. United Concordia will now be your dental provider. You also have access to a new employer-sponsored employee assistance program, as well as a travel assistance program. So I'll be able to cover those later in the meeting. Okay, so open enrollment window would be from now until Monday, August 15th. So if you need to add or remove dependents, right now is the time to do so. Everyone does need to enroll onto a new dental plan, okay? Everyone needs to designate a beneficiary, and then if you're not on the plan, if you're a new hire and have satisfied your waiting period, right now is your opportunity to enroll, okay? We're doing this through Maxwell Health Benefits Administration System, and so we're no longer using paper applications. You just have to log into Maxwell Health. You're going to receive an email that's going to prompt you to make a username and password. Okay, so the open enrollment period is the only time of the year when you have the opportunity to make plan changes without a qualifying event, such as loss of insurance coverage, like if you were covered on a spouse's plan and you lost that coverage, birth of a child, marriage and or divorce. And this is what the Maxwell Health Benefits Administration System looks like. So you're going to have a welcome screen that's going to prompt you to make a username and password. Then you'll review and confirm your information. It's very important that we're using Google Chrome as the application for this, as it will not work on Internet Explorer or Mozilla Firefox. If you have dependents, you will enter the dependent information after you confirm your own information. Then you get to shopping for your benefits. So you're going to have options of plans here. You select a medical plan, dental plan, vision plan, and then you select if you want to cover your dependent or not. Once you review your benefit summary, you're going to see exactly how much comes out of your check, each check, and then you're going to see a monthly total. Then you just check out, okay? So one thing we wanted to address is what is making medical insurance so expensive. And I'm sure that you've all noticed that it's very expensive. The cost of delivering medical care increases 5 to 10% every year. So if you went and had to stay in an intensive care unit for a weekend, that would be about $58,000 this year. And next year, that's going to increase. And so the price of delivering medical care keeps on increasing, and so do our premiums. A lot of this has to do with new prescription drugs, new diagnostic technologies, increased life expectancies. You know, we're living a lot longer, but it is costing more to keep us alive. The cost of labor, hospitals and medical centers, and then its utilization. It's the way we as a whole consume care. Then you stick in the Affordable Care Act taxes, fees, and federal compliance requirements. and add an additional 6 to 8% to the premium cost since 2014. So managing the cost, utilization, we want you to be using your physicals, getting your physicals, getting your well woman exams, and then also just healthy diet and exercise. Good food is good medicine. So this will help continue the program for benefits. Okay, so the medical plan providers that we have this year are going to be Anthem Blue Cross. You have an option between the Blue Cross Gold PPOC or the Blue Cross Gold PPOD. The discontinued California Choice Plan is Health Net Gold PPOA. So if you were on the Gold PPOA from Health Net, you will need to elect one of these two new plans. Other plan providers include United Concordia for dental insurance, Unum for group life, voluntary life, and long-term disability, and VSP for vision. So we're going to go ahead and review your summary of benefits now. Now we have two PPO options available. Anthem Blue Cross is a nationwide carrier with a very strong network nationwide. The difference between the PPOC and the PPOD is that one, PPOD is designed more to hit your maximum out of pocket, and PPOC is designed more to keep your out-of-pocket costs lower. It starts all with the individual deductible. PPOC has a $500 deductible. PPOD has a $1,200 deductible. For a family, you have a $1,500 deductible and a $2,400 deductible. For individual out-of-pocket maximums, this number represents the most that you would spend in one plan year. You have a $4,000 limit on the PPOC and a $3,500 limit on the PPOD. For family out-of-pocket maximums, you have an $8,000 limit on the PPOC and a $7,000 on the PPOD. For family out-of-pocket maximums, 2 members of the family or more would have to hit that out-of-pocket maximum, and everything else would be covered at 100% by the insurance company. On the PPOC, for primary and specialist office visits, you have a $25 copay for the first 3 visits and then a 20% coinsurance after that $500 deductible. Now, most doctor's visits are going to be about $100 cash price. So if you're paying 20% of that, that's going to be around a $20 to $30 fee. On the PPOD, for a primary care office visit, you have a $20 copay. The deductible is waived. For a specialist office visit, you have a $40 copay and the deductible is waived. As you can see, preventative care is no charge, so your physicals and your well woman exams, please be getting those on an annual basis. If you do enroll dependents under 18, pediatric vision and dental will be included on both plans, okay? So for lab, x-ray, MRI, and high-tech services, you have a 20% coinsurance after deductible on each plan. If you're to be hospitalized on the PPOC, you have a $500 copay per admission after that deductible. Now, per admission means that whether you stay 1 night or 7 nights, you only pay that $500 per admission copay, okay, after that $500 deductible. For the inpatient hospital services on PPOD, you have a 20% coinsurance after that $1,200 deductible. If you were to have a surgery on the PPOC, you have a $250 copay per procedure after the deductible on the PPOC, and on the PPOD, it's a 20% coinsurance after the deductible. For emergency room visits, you have a $250 copay per visit after the deductible on PPOC, and a $200 copay plus 20% coinsurance after deductible on PPOD. For urgent care visits, it's a 20% coinsurance on PPOC and a $100 copay on PPOD. For ambulance rides, a 20% coinsurance on PPOC and a 20% coinsurance on PPOD. All right, then we get to the prescription drugs. As you can see, on the PPOC, you have no annual prescription drug deductible. However, on the PPOD, you have a $250 deductible that applies to brand name, non-formulary, and specialty medication, okay? There is a mandatory generic substitution, so if you do stick to generic medication which about 91% of all medication out there has a generic substitute, then you're going to have a $15 copay, as well as on the PPOC, $15 copay. However, if you go to brand name medication, for a 30-day supply, you'd be paying a $40 copay on PPOC and a $40 copay after that one-time $250 deductible on PPOD. For Tier 3 non-formulary newly patented medication, $80 copay on PPOC and an $80 copay after that one-time $250 drug deductible on PPOD. Now for Tier 4 specialty medication, you have a 25% coinsurance up to a $250 max on PPOC. And on PPOD, you have a 30% coinsurance up to a $500 max. Okay? If you're taking anything for a chronic condition, we would definitely recommend that you take a mail order form to your doctor, have them fill it out, so that you can get 3 months of your medication delivered to your home and only pay 2 months. Okay, delivery fee is waived. So those are your medical plan options for this year. How to find a provider? You go to calchoice.com, you click on medical carriers, and then you put your Anthem Blue Cross carrier, you put your physician gender, or find a doctor within your zip code. What you're going to see is a list of thousands, if not hundreds of doctors, but if you start specifying if you want a specific doctor, that doctor is likely to be in the Anthem Blue Cross PPO network because it does have a national network coverage. Okay, then we get to group dental. Group dental is going to be through United Concordia this year. You do have an individual deductible of $50, family deductible of $150, an annual benefit maximum of $1,500 per insured person. You have no coverage waiting periods. You have an out-of-network reimbursement of 90th percentile of usual and customary. What that means is if you go to a dentist that does not accept insurance, this plan will still reimburse you for out-of-network reimbursement. So the dentist around his area, his or her area, whatever they are charging and is the contracted price with the insurance carrier, you'll be reimbursed 90th percent of what that usual and customary charge is. Okay? For preventative and diagnostic care coverages, you have no charge, and this includes exams, x-rays, cleanings, fluoride treatments, sealants, space maintainers, and palliative treatment that's an emergency basis. Okay? For basic care coverage, you have 20% coinsurance. The insurance company pays 80%. Okay? And basic care benefits include simple extractions, endodontics, which are root canals, periodontics, fillings, oral surgery, general anesthesia, repairs to crowns, inlays, onlays, dentures, and bridges. Okay? When you get down to major care benefits, this is going to include crowns, inlays, onlays, bridges, and dentures. You have 50% coinsurance. The insurance company pays 50%. Okay? We do include an orthodontia benefit of $1,000 annual maximum, and it is for diagnostic, active retention, and treatment of orthodontia treatment. Okay? It's for ongoing orthodontia benefit or a new orthodontia benefit. Okay? So that is our new dental PPO plan. How to find a provider is going to be on unitedconcordia.com or an 800 number right here. You log on, you select the PPO dental plan, and you'll be able to find a dentist in your area. Vision insurance is going to be administered through VSP, and you have an eye exam that you can get every year. You have lenses that you can get every year. But if you got frames this last year, you're going to have to wait 2 years from the month that you got frames. The copay for an eye exam is $20. If you get single, bifocal, or trifocal lenses, it is a $20 copay. For frames, you have a $130 allowance. But if you get a pair of frames that's, say, $200, that $70 remaining balance will be 20% off. Okay, and that's for using an in-network optometrist. You can get contact lenses instead of frames and lenses, and you do also have a $130 allowance for contact lenses. Now, LASIK surgery discounts are available, but you will need to use an in-network Basic Surgery Center. This is how you find an optometrist in the VSP network. VSP.com, find a VSP doctor, enter your zip code and hit search, or you can call the 800 number. All right, so those are some of the benefits that we hope that you're using. We hope you're getting a physical every year, one woman exam. We hope you're getting cleanings every 6 months, twice a year. And we hope you get your eyes checked. Now, Ardmore Made Goods has taken into consideration some benefits for you that we hope that you never use, which is life insurance. Basic life insurance will be provided to you at the amount of $50,000. Now, if you pass away in an accident, you get an additional $50,000, and that would be your beneficiary getting that additional $50,000. Say if you survive that accident, you have a monthly benefit of long-term disability of 6% of your covered pre-disability monthly pay, okay? That's up to a maximum of $6,000. So if you have long-term disability, I'm sorry, I'm hearing a little bit of chatter on the, here we go. Let me just go ahead and mute. Sorry about that. Heard some interference coming in. Hopefully that fixes it. So if you have a long-term disability claim and you can no longer work, you have 60% of your pre-disability income covered by this plan. The monthly benefit maximum of this is $6,000, okay? The benefit begins after 90 days of disability. However, it can last until 65, the age of retirement. So if you are no longer able to work, you get 60% of your pre-disability pay up to the age of 65. Okay? All right. If you feel that $50,000 is not enough life insurance, we do offer voluntary life insurance limits of up to 5 times your salary. Okay? However, guaranteed issues are at $70,000 per employee. What a guaranteed issue means is that you can get $70,000 worth of voluntary life insurance with no medical questions asked. Okay? You can get your spouse $25,000 of life insurance with no questions asked, and a child you can get $10,000 of life insurance with no questions asked. If you were to exceed that $70,000 limit and say have a $500,000 life insurance limit, you would have to answer 10 simple medical insurance questions honestly. Okay? All right, new this year, we have an employee assistance program and a travel assistance program. So you will receive a folder which has the employee assistance program from Ceridian, which you can use for couples therapy, family counseling, legal assistance, financial planning, just about any kind of issue that you need them to offer you a resource for. You can call and ask them, and chances are that they're going to be able to offer you assistance. You're going to have access to a 24/7 800 number that you can call for assistance on any issue that you have, be it work-related or personal. Okay? You also have 3 visits with a master's level therapist every 6 months from this plan, absolutely free. Okay? So that is the employee assistance program. We hope you use that. Then you have the travel assist program, which works for roadside or medical emergencies. So if you have a roadside or medical emergency, you will have a card with an 800 number on it. Again, it's 24/7. You call, or you have your spouse, your children, whoever you're traveling with, call this number and let them know what your emergency is, and they will scatter resources for you. We've had extreme circumstances where people have gotten hurt in third world countries and they are repatriated to Western medicine. We've had just instances where someone lost their passport and they call the number on the card and they're able to get to a U.S. embassy and get the process started more efficiently. So it works for a lot of different emergencies. We hope that you have it when you need it. So make sure you have that in your wallet and just know that you have that benefit. That concludes our open enrollment meeting. Now, if there's no questions, please feel free to log on to Maxwell Health, where you're going to be able to enroll onto your benefits. You'll be able to compare pricing, compare benefits. You're going to be able to see how much is coming out of your paycheck. So really, we're going to rely on you to go onto Maxwell Health and see what plans are right for you. Okay, thank you so much for your time. And please feel free to contact HR if you have any questions.